Welcome to the Michigan Trauma Quality Improvement Program. In this section of orientation, we will review the processes of care for opioid use. Tablet type 1 is the type of opioid tablet prescribed for a patient at discharge. This includes capsules if prescribed instead of tablets. Only report the opioid component of the prescription. We have provided a drug search link under the Resources section for your use as needed to help determine opioid types. Do not report if patient elopes and prescribed status is unclear. Tablet type 2 is reported for an additional type of opioid tablet prescribed for a patient at discharge. Only report the opioid component of the prescription. Do not report if patient elopes and prescribed status is unclear. Solution type 1 is the type of opioid solution prescribed for a patient at discharge. Report cartridge, concentrate, elixir, liquid, pen injector, pump reservoir, syringe, and other similar solution forms that were prescribed as units per milliliter in the solution data fields. Only report the opioid component of the prescription. Do not report if patient elopes and prescribed status is unclear. Other type 1 is the type of opioid other than tablet or solution form prescribed for a patient at discharge. Just like with tablets and solutions, only report the opioid component of the prescription, and do not report if patient elopes and prescribed status is unclear. Strength refers to the strength of opioid prescribed for a patient at discharge. Only report the opioid component of the prescription. For example, oxycodone 5 mg combined with acetaminophen 325 mg, report the number 5. Round to the 10th decimal place where applicable. Units refers to the drug units of opioid prescribed for a patient at discharge. Again, only report the opioid component of the prescription. Milliliters of solution refers to the milliliters of solution of opioid prescribed at discharge. For example, an acetaminophen codeine solution of 120 mg and 12 mg per 5 mL is prescribed. Report the numeric value of 5. Round to the 10th decimal place where applicable. Forms refers to the form of other opioid prescribed for a patient at discharge. Please see the different element values listed. Maximum per dose is the maximum amount of drug per dose prescribed at discharge. Several examples are provided for your use. For one example, if oxycodone 5 mg, 1 to 2 tabs every 4 to 6 hours is prescribed, then the patient can take a maximum of 2 tabs per each dose. Please report the numeric value 2. Round to the 10th decimal place where applicable. Maximum frequency per day refers to the maximum frequency opioids can be taken in a 24-hour period as prescribed at discharge. Several examples are provided for your use. For one example, if oxycodone 5 mg, 1 to 2 tabs PO every 4 to 6 hours is prescribed, the patient can take a maximum number of doses per day of 6. Report the numeric value of 6. In other words, 24 hours divided by 4 hours would be the 6 times the patient can take the meds in a day as prescribed without going over. Quantity is the quantity of opioids prescribed to a patient at discharge. For tablets, report the total number of tablets prescribed. For solution, report the total milliliters of solution prescribed. For other, report the total number of units, example, patches or lozenges, prescribed. Patients discharged to acute rehab or skilled nursing facilities may have an opioid prescription listed on their discharge summary, but no quantity listed because the providers at that facility will continue to dispense. For these scenarios, report the opioid listed with 0 for the quantity. Thank you for watching.